Thokoza, Sylvester, so why is it that you believe you should be part of the first batch to get the vaccines?
Thokoza Ndauwe. Yes, we definitely need to be the first one, together with the nurses, together with the essential services, because you can remember, we as traditional practitioners, we see clients in a daily basis. About 8 or 85% of people visit traditional practitioners in the different areas. So we can assist the department in terms of informing our personnel, informing our client, informing everybody in terms of avoiding spreading of this virus. And initially, you remember that the Constitution says as well that we as traditional practitioners were equal to nurses, we're equal to doctors. So when time comes for us to benefit, seems like the department happened to forget us, that we need to benefit in this vaccination. Yes, I know that sometimes they will think, no, traditional practitioners, they cannot read, they cannot write. Doesn't matter. We cannot read, we cannot write, but we have indigenous knowledge that our ancestors have empowered us so that we can, in fact, help people, help the community, help the society.
People are still visiting you, as you rightfully mentioned. How have your members and yourself been able to, protect yourselves and your clients that come to see you during this difficult time?
As I'm talking to you now, I'm in one of my practice, in my consulting room. My staff here, they're wearing the PPE because they have to be prevented, and we have the sanitized way. We have also they have that when my client walk into the practice, they need to be screened, and we need to take the record as well, the temperature, etc., etc. And what we do as a traditional practitioner, especially in my practice, I have prepared the special medicine, the special herbs. Doesn't matter you have a symptom of COVID or not. If you are willing or if you want, you take a little bit of that medicine you drink, so that when you sit in a queue, even if someone is in this condition of COVID, is affected by COVID, then you can be protected. I do have the machine that we fumigate the area before we start, and when we finish also we do the same thing. So we see people who can come. Some of them, they can say that yes, they went for checkup, they have informed that they have COVID, and some of them, they went for quarantine, and some of them, they won't even tell you. They will come, they will tell you other story, that I'm suffering from this and that. So myself, I have to be well protected, well equipped, well dressed, etc., and also sanitizing, wearing gloves, wearing the overall that will protect me, and after work, we throw away those things. We don't just throw away. There's a way, there's a procedure, how we bend the protecting clothes that we're wearing during the day. So that is what is happening in our area or in my practice, and we have educated our traditional practitioners as well, that they must do the same. Even if they cannot afford to buy the protective clothes, they must at least have a sanitizer, they must at least have the mask, they must at least have the temperature machine, so that you can see the higher temperature. You cannot accept the person who have that higher temperature in your Ndumba or wherever in your yard.
What has been the level of engagement with the authorities in terms of getting traditional healers to get the jab along with healthcare professionals?
No, not as good as it's supposed to be. All the time, traditional practitioners, we need to push. We need to tell the authorities. We must tell the authorities always, using the media, writing letters to them. They don't even respond sometimes. And in most cases, they don't respond. So the engagement is not that good, because all the time we need to ask them why you leave us behind. When the COVID started, I'm the one who raised the voice that don't leave traditional practitioners, because we can help, we can assist. We have a knowledge of how we can assist our people. We are not saying it necessarily we have a medication to keep people who suffer from COVID-19, because this is a new disease to us, this is a new virus to us, but we do have something that it can at least help people, to avoid this kind of being vulnerable to the disease. And we also used to inform our people how to steam. If they need to steam, if they need to drink some herbs, they must go through a guidance by a traditional practitioner, a person who can guide them how you can steam, how many should you steam. You're not suffering from epilepsy, you are not suffering from asthmatic, you are not pregnant, like maybe 7 or 8 months a lady that she is about to give birth. You cannot get that lady to steam. But then what should we give to that particular person so that we at least help her to their lungs, cough and throat, etc., etc. So we do have some kind of medication that we can assist. That is not to say we can cure the COVID-19. This is a new disease. People must be careful. All of us, we lost a lot of traditional practitioners. Those ones, they say that they can heal, they can cure COVID problems. They also passed on because they ignored the rules, they ignored to respect the rules that the government or the department have told us to respect.
Just finally, perhaps for us, you are part of the SADC Traditional Health Practitioners Association. What is it that some of your counterparts from other countries in the region have told you about their experiences where they are?
Well, I'm the president, in fact, of this association. I'm the president of SADC continent. In all these countries, such as Mozambique, Zimbabwe, Swaziland, in other countries, the government or the Department of Health, they involve traditional practitioners, and they are working together. They advise them how to handle the cases of COVID-19 or any kind of diseases. And the traditional practitioners, they're playing a very big role. That's why on those countries, you don't see so many fatalities. You don't see so many vulnerable people because traditional practitioners, they are well informed. And they are also taking part. Even if they use the herbs, they must use the herbs under the guidance by scientists or people who have a knowledge. Because, you know, some of traditional practitioners, they will tell you that the ancestors told me to do this and that. It's fine, your ancestors have told you to do this and that, but not for everybody, because everybody's got the system in the different body that you have to use a different medication, different herbs to the particular person. So the continent is working very well, and in other countries, we don't have so much fertility like in our country, in South Africa.
Sylvester Hlati is the president of the SADC Traditional Health Practitioners Association. Togos.